the key to healthcare in the future could be putting everything under one roof. At Ochsner Health Systems in New Orleans, they're taking that message to the next level.
I'm Andy Roesgen in New Orleans for AMGA's Institute for Quality Leadership. Integration, care coordination, a value-based payment model. It's all part of the goal of higher performing health.
The physicians practicing that are members of AMGA are typically in groups of small to large size that have the opportunity to work together as partners and take care of the patient on a continuing basis, as opposed to handing somebody off to somebody else, repeating tests, repeating diagnostic activities and so forth. It does create that value proposition that you can't get otherwise.
And integration of patient services and care coordination are evolving fast, driven by advancements in technology.
The face-to-face visit will likely go away in many cases, that it doesn't require the patient to physically come into the physician's office to get all of their questions answered, whether it be through the patient portal, e-visits or e-consults where we're using video.
This is a new ballgame, even putting in electronic medical records. What's interesting, when that does go in, then systems can talk to one another about certain patients as opposed to just one-time events in that regard.
But an even bigger challenge in healthcare these days is the move from a fee-for-performance payment model to a value-based payment model. To put it simply,
no outcomes, no income. This patient population you're serving better off, and there are measures around, for example, blood pressure rates, diabetes rates, congestive heart failure rates. If your population is better than the standard, then you're probably doing your job very well. If it's less, there's room for improvement.
Healthcare is increasingly driven by cost-conscious consumers. In some cities, hospitals are now required to post the cost of their surgical procedures online.
You walk into a car dealer, at least you know what the price tag says. We don't even have that.
Transparency of prices is absolutely critical as the patients look to identify where they can receive that care. That's the highest quality, highest outcomes, but at the lowest cost.
Here at Ochsner Primary Care Hospital in New Orleans, words like care coordination and integration aren't just buzzwords or wishful thinking. They are a way of life. The specialists and the doctors are all together. It's just a whole shift in our thinking about how to interact with each other.
Working as a team really is stronger than the individuals. Co-location is one of the key elements of integrated care. We have not only physicians, nurse practitioners, physician's assistants, the medical assistants, et cetera, but we also have a social worker, dietitian, diabetic educator, complex case manager, and several other roles that support patients' needs.
Like any elderly person, I have a million problems. I have a million doctors at Ochsner, all of which have been incredibly responsive.
And while the patient benefits from this kind of integrated care, the hospital certainly does too.
The way primary care impacts sort of the cost of care is in avoiding duplication of services, also getting people directly to the most correct specialist instead of somebody with a runny nose goes to an ENT who's a surgeon, which is a more expensive resource, where maybe they would have benefited from an allergist. Primary care can sort of steer you into the most cost-effective location without any stops in between.
This is Ochsner's O-Bar, the first of its kind in the nation. It's like the Genius Bar at an Apple store, right at the hospital's front entrance.
It's cool, it's a lot of fun because people are really interested in it, and that really helps that they want to better themselves.
The practice of medicine is not an individual sport. It is team play. And so we absolutely have to do that, and we are doing it. And it makes an absolute immediate difference in the care of our patients.
In New Orleans, I'm Andy Roesgen.